Hi, welcome to the PWSA USA Family and Medical Support Update. My name is Stacy Ward. I'm the Director of the Family and Medical Support and Special Projects for PWSA USA. The members of the Family and Medical Support team include myself, Diane Sealy, our Parent Support Coordinator. Many of you have either spoken with her or know her personally, as she has a son diagnosed with Prader-Willi syndrome. She's been with our organization for 5 years and will be leaving us very soon to pursue her dream of opening a bed and breakfast. We are currently seeking a replacement for Diane. I'll talk a little bit further about that as we go on. Next is Mary Burr. She is our Medical and Research Coordinator. Mary has been with us for a little while. She's also a nurse practitioner with an extensive number of years of experience working with endocrine issues. And then finally is Kim Tula. She has been with us for a year. She is familiar to many of you. She runs the Yip and Yap program at Convention and previously worked for the Prader-Willi Homes of Oconomowoc in Wisconsin. If you call our 800 number or email support@PWSA USA, you'll get one of the four of us. We're going to go over some of the things that the medical support team does, what the family support team does, what we do in new diagnosis, and then we'll take questions at the end. The medical support program is designed to provide families with current information on a variety of medical topics that are pertinent to Prader-Willi syndrome. We provide physicians with best practice advice for treating patients. We can facilitate doctor-to-doctor or peer-to-peer consultations. We very often do this for endocrinology and psychiatric concerns. We also train professional providers to recognize and understand the medical complexities of Prader-Willi syndrome that they wouldn't otherwise know by providing those professional supports to people with other intellectual developmental disabilities. The one thing that we do like to emphasize is that the medical support program is not designed to give medical advice on our public Facebook forums. The information that is shared in those forums really is just a small snapshot. And in order to give accurate and professional advice, we need to have a full conversation and ask questions and gather more information. So we will not be providing any specific medical information in those groups. What we may do is put out a consensus statement from our clinical advisory board or our scientific advisory board that will speak to in generalities for people with Prader-Willi syndrome. These statistics speak to 2019. The purple refers to the number of inquiries we've received from families, professional providers, physicians, or schools about just general medical questions. All of the green is the medical advocacy. That covers things like working with insurance companies to have things covered. Sending information to a physician or speaking with emergency room physicians or nurses when somebody has experienced some sort of medical crisis. And then the small pink up here is the growth hormone questions. Many of those end up being appeals. Mary Burr, our medical and research coordinator, has a template that she uses and can help provide to any of you who are experiencing that initial denial for growth hormone. It happens very often, even though growth hormone is an approved treatment for Prader-Willi syndrome. If you have experienced that or you do in the future, please do not hesitate to reach out. In 2019, we had 172 new diagnoses that came through our door. That includes our international support. PWSA USA does provide a little bit of international support for new diagnoses. Many of our materials have been translated into other languages, especially the medical alert booklet. And because many other countries do not have a support agency, families find us, and then we share that information. The vast majority of the new diagnosis information that we receive or submissions are in that 0 to 3 age group. Many people are receiving that diagnosis between 1 and 3 weeks, but that doesn't mean everyone does. There's still quite a few people who may get that diagnosis after age 3. In 2019, there was 22 families that received the diagnosis later. The non-medical family support program is designed to provide support, information, and training to everyone who could touch your child's life. We focus on activities such as advocacy, which could be individual advocacy and public policy advocacy. Behavior, although a large umbrella topic, there's many subcategories in this topic, and it includes behavior at school and at home, diet and nutrition, legal concerns. Very often that is guardianship issues, theft issues, or unfortunately, Child Protective Services have been involved or contacted. And in many cases, that happens when a child tells someone who is not familiar with Prader-Willi syndrome that their parents are not allowing them to eat or are restricting their food. We do participate a lot in helping families find appropriate or train their residential and day programs, and then school issues could cover things like training a school, reviewing an IEP or an FBA, participating in those IEP meetings, attending school hearings. There's a lot of things, as you guys all know, that happen at school age, and we can be there to assist. The things that get covered under individual advocacy include growth hormone appeals, those insurance appeals for physical therapy, occupational therapy, speech and language therapy, and applied behavior analysis, eligibility appeals for those in-state services, Medicaid waivers, that sort of thing, SSI, SSDI, and Medicaid, guardianship, and then those IEP mandates that I just spoke about. Here's some of the subcategories of things that we receive contact from people about under the umbrella of behavior. Aggression, so it could be hitting, punching, kicking. It could also be self-aggression. So besides skin picking, some people will pull their hair out or will bang their head, some of those types of things. Perseveration, I'm sure we all have experienced that perseveration where perhaps somebody is asking that question over and over again or telling you the same thing over and over again so that you don't forget. Skin picking and elopement. We spend a lot of time talking with people about positive behavior intervention and approaches. We review plans written by school psychologists and ABA therapists. We assist in developing those plans, and we have the tips and strategies to prevent challenging behaviors video that's on our website as well as on our YouTube channel. If you haven't taken a look at that, it's a really great beginning tool for starting to put those things in place. We get asked a lot of questions about diet and nutrition. It is a topic that comes up over and over again. I want to be very clear and be sure that everyone understands that as an organization, we do not endorse one diet over another. We believe that everyone has a diet that works best for them and their family, and what that looks like for one person may not be what it looks like for another. We do have some nutrition guidelines and resources available to you. The Latham Center's cookbook follows more of a Mediterranean diet approach, and then the guidelines are broken down by age groups, the infants to toddlers, toddlers to adolescents, and adolescents to adults. We work with those professional providers who provide either respite, community rehabilitation, day program, or residential services to individuals with Prader-Willi syndrome. In many cases, these providers work with a very, very small group of individuals with Prader-Willi syndrome. So we may provide a lot of training and guidance for them. Professional providers spend a lot of time training their staff on all sorts of different things. However, very few spend a lot of time training their staff on Prader-Willi syndrome, and that's where we can be of assistance to them. We can help provide training for those providers either in person, through Skype, or conference calls. We provide them with a lot of written material and partner with our professional provider advisory board to contact them and mentor those providers. There was a task force that was formed in 2019 that helped to improve the listing of residential providers we're aware of. It's called the Residential Care Database, and you can get access to that by contacting either Kim or I at any time, and we can send you that list. At times, children with Prader-Willi syndrome face challenges in school. It could be related to food, transitions, their peer-to-peer relationships. The academics could become tough, and those are all areas that we can help both the child and the parent, but also the school navigate those waters. Resources that we have available for that is our Wyatt Special Education Advocacy Training, which was named after David Wyatt. He was our first family support counselor. You can access that. It's a completely online training by going to our website. Under family support, if you scroll down, the last link is to that online training program. You can watch all 7 modules, you can look at one of the resources, or you could watch one module and all the resources. You can utilize that any way you wish. I encourage you to share it with your teachers and your school psychologists. The information is invaluable and not only will assist them in providing the supports that your child with Prader-Willi syndrome needs, it will help with other students with intellectual and developmental disabilities that they may be supporting. We have an educator DVD, the parent educator packet, which is being reviewed and constantly updated by our special education advocacy board. And then, like I spoke about earlier, the training, the IEP reviews, and the IEP meeting participation. And these are the statistics for 2019. That big purple box is the number of activities that we received for people who are looking for residential placement. This is becoming a bigger issue as funding continues to get cut for these types of services. And because of early diagnosis and awareness and parents doing just an incredible job, people with Prader-Willi syndrome are living longer than they ever were before, and in many, many cases outliving their parents, increasing that need for some sort of living arrangement to be provided once their parents or their support systems are no longer here. The green refers to those school concerns. The very small orange is the behavior. So what's exciting about that is behavior was the #1 contact that we received in 2018. And because of you guys talking to each other, because of some of the resources that I think we've put out, and some of the proactive strategies that people are using, those contacts have decreased dramatically. And then the final pink little section is those people who are either in a day program or a residential setting that needs assistance. So either the program itself has contacted us or a family has contacted us asking us to help provide some support and training. So what's new for 2020 in the Family and Medical Support team? As I mentioned earlier, Diane Seeley will be leaving us, and we are actively recruiting for a part-time parent support coordinator. If you're interested, please send your resume to Steve Quior. We are scheduling interviews right now, so if you are interested, please get that in as soon as possible. And then the projects that we're working on for 2020 include the Continuum of Care project. And the biggest thing we're focusing on with that right now is opening an inpatient unit for both children and adults with Prader-Willi syndrome. As we know, the Children's Institute in Pittsburgh is no longer open and accepting patients, so that's no longer an option. And Nexus in Houston, Texas only provides those inpatient support for children. So right now there is nothing for adults. And our hope is with this Continuum of Care project, there will be that critical inpatient program that will support both children and adults. Some of the other pieces of that will include some care coordination and some training, again, for all of those people who touch your child's life. The sibling toolkit is something we're focusing a lot on this year, is providing that support not just to siblings, but to parents, to be sure that they're helping support their children without Prader-Willi syndrome. Just recently, we started the sibling Facebook support group, and I encourage you to have your children join if they are sibling of somebody with Prader-Willi syndrome. A comprehensive bereavement program, which will help you train support your children when they experience the loss of a loved one, but also support for you guys as you grieve whatever losses you may experience in your life. The residential provider online training is going to be set up similar to the Wyatt special education training. It will be online modules with downloadable handouts to provide that information and support and training for residential providers. The parent educator informational packet, which I spoke about earlier, the Special Education Advisory Board is actively updating the information in there to make sure that it is constantly current and speaks to the most current best practices. Daycare informational packet, this came from requests from many of you who are going back to work or have gone back to work and are looking for some information that you could share with your daycare provider that isn't to the level of that early intervention IEP type of information, but really what they need to be aware of in more of the daycare setting. So that's something that we're working on. And then finally, a dating and relationship toolkit. And the purpose of that toolkit is going to be multifaceted. It's to provide information for individuals with Prader-Willi syndrome about healthy relationships and forming those relationships, as well as for single parents who are considering dating, how to talk to your child about you dating, how to talk to a potential significant other about your child with Prader-Willi syndrome and the diagnosis. And again, that was something that came from many of you. I would like to encourage all of you, if there is a topic or an area that you need additional support, please reach out. We're always looking for ways to be sure that we're providing you with the information that you want and need that's timely. So you can email either me directly at sward@pwsausa.org or our support at pwsausa.org. I'd like to thank you all for taking the time to participate. I look forward to hearing from you. Please email, call us if you have any questions or would just like to provide feedback. Appreciate it. Thanks so much.